All right, welcome back to ABA exam review and the continuation of our RBT practice questions series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Naomi is considering options for her daughter, who will ask for juice constantly whenever she gets home from school. Naomi decides she will provide her daughter with water on the way home from school in an effort to avoid the juice asking behavior. What type of antecedent intervention is Naomi likely using? So we have more of a challenging question here. It's more of a high level question. But with every question on the exam, we're going to break down what information we know and what the question is asking about. The question is asking about the type of antecedent intervention. So immediately we know we're using an intervention that involves an antecedent. That means all consequences are out of the question. That means reinforcement, punishment, extinction cannot be our options because those are going to be consequence interventions. So now what is Naomi trying to do? Well, she knows her daughter will ask for juice whenever she gets home from school. And so, in order to stop that, she gives her daughter water on the way home. So, the idea is give the daughter water on the way home. Therefore, she won't ask for juice when she gets to the house. Now, why would that be effective? Well, let's think about A, motivating operations. With a motivating operation, where you're making you want or not want something, right? We're increasing or decreasing the value of something. If Naomi gives her daughter water, then what she's trying to accomplish is decreasing the value of juice. She's altering the motivation to go ahead and ask for juice. And so that's a very simplified way of looking at a motivating operation. But as an RBT on the exam, that's how you should look at it. A motivating operation is going to make me want something or not want something, more or less. And so by giving the daughter water, it decreases the value of the juice. If you look at B, negative reinforcement, well, we know we're using an antecedent intervention, so we can't be using a reinforcement intervention unless it was non-contingent reinforcement, but that's not what negative reinforcement is, so B is out. C, response prompting. Prompting comes after the response, and Naomi is doing this prior to her daughter asking for juice, so she's not using any prompting procedures. And then D, functional communication training. Naomi is not working on communication with the daughter. She's simply providing her what the daughter may want, which is something to drink, which is, in this case, she's giving her water on the way home, trying to decrease the value of the juice whenever they do get home. The type of antecedent intervention Naomi is using, or likely using, is motivating operations. An initial assessment is set to take place in just under a week. Your supervisor is working with you on how to best set up the assessment to identify the possible functions of the behaviors you may target in the treatment plan. What type of assessment is the least effective for determining function? Question is asking about assessments and what assessment would you use, would you not use? In this case, we're asking about the least effective for determining function. All of our assessments serve a purpose. We have assessments to determine goals, to determine preferences, reinforcers, and functions, amongst other things. In this case, we're setting up an initial assessment, and you're going to work with the supervisor, and your goal here is to identify functions. You always want to work to understand, what are we trying to achieve? What's the purpose here? Well, the purpose here is to identify a function. And so if we're going to choose an assessment, we want an assessment that's going to be effective for identifying functions. The question wants to know, what would be least effective for determining that function? A, ABC narrative recording. Well, ABC narrative recording is a type of direct assessment where we're looking at antecedents and consequences. Is it going to give us the function 100%? Probably not, but it is a rather effective way of making a hypothesis. What about B, an interview assessment? Well, an interview assessment would be considered an indirect assessment. And an indirect assessment is always going to be the lowest form of assessment because we're not actually observing and manipulating and tracking the behavior of interest. If we're just doing interviews, we're not actually observing anything. We're just talking. So an interview assessment, an indirect assessment, is always going to be the least effective for determining function. Let's read all of our answer choices. C, functional analysis. Functional analysis now is the highest level of assessment for function. That is the best way to determine function. With the functional analysis, we're actually manipulating things, antecedents and consequences, to look at the function. And then D, event recording. Event recording, like ABC narrative recording, is a direct assessment trying to measure the behavior, get an idea of behavior, and try to start to hypothesize the function. So therefore, the least effective out of these four for determining function would be B, an interview assessment. Prior to starting treatment for a client, your supervisor discusses possible prompting procedures with the client's dad. The dad, in response, tells the supervisor that they would like to use prompts that are unintrusive whenever possible and that they do not want to use physical prompts. What might be the best prompting strategy in this case? Now, you got to put yourself in the behavior analyst shoes. We have a prompting question, and we want to know the best prompting strategy. We know the dad is telling the supervisor they want the prompts to be unintrusive. And when we say unintrusive, we mean we want prompts that are only cueing or signaling or giving the minimal amount of help or information to the client. If you think about a physical prompt, that is very intrusive. You're physically prompting the client on what to do. So not only does the dad want to avoid unintrusive prompts, they also don't want to use physical prompts. So we have some limited options here. It can't be intrusive. We want the most unintrusive, and we can't use physical prompts. In that case, what's the best strategy to use? A, most to least. Well, a most to least strategy won't be the best. A most to least starts at physical. It starts with errorless. It starts with the most intrusive. So A is out. B, graduated guidance. Graduated guidance is a type of physical prompt, so we can't use graduated guidance because in the question, they don't want to use physical prompts. So we can't use graduated guidance. What about C, least to most? Least to most is probably the best idea here. Least to most gives you options because you are starting with the least intrusive, but then you can take it different directions depending on the client's needs. If we say D, verbal prompting only, well, that really limits you. Verbal prompting may not be very intrusive, but what if the client doesn't respond to verbal prompts? So the better strategy is going to be least to most, where you have options depending on the client's needs and what they're responding to. In addition, you're meeting the dad's demands of being unintrusive and not using physical prompts. So the best prompting strategy in this case would be C, least to most. A functional communication training intervention calls for reinforcement every 4 to 7 times a client successfully and independently communicates that they are hungry, thirsty, tired, or bored. As the technician, what type of reinforcement schedule are you using? Basic reinforcement schedule question or reinforcement schedules include fixed ratios, variable ratios, fixed intervals, variable intervals. And so when we have questions about basic reinforcement schedules, always ask yourself first, are you thinking about responses or time? Because if it's a ratio, we're thinking about responses. If it's an interval, we're thinking about time. In this case, we're reinforcing every 4 to 7 times a client communicates. We're looking at the number of responses. It's not about time, it's about the client doing the correct behavior. That tells us it's definitely a ratio schedule. Now we have to ask ourselves, is it fixed or is it variable? With a fixed schedule, you've got a set amount of responses, right? With a fixed ratio. This might say reinforcement every 5 times. That is fixed, not changing. When we say every 4 to 7 times, now we're working on an average. We're working with a variable amount of responses. And so as a technician, if you're reinforcing 4 to 7 times the response is done, you're going to be using a variable ratio schedule. With basic reinforcement schedules, you want to break it down like that, especially when you're first starting. When you get good at these, they become very simple, and you might not need to break it down that much. But if you ever get stuck, or if you're just starting, work on that. Am I dealing with a ratio schedule or an interval schedule? And is it fixed or is it variable? In this case, we have a variable ratio schedule. Frequency is useful for counting how many times something occurs and also for calculating the rate of behavior. What is something that is required in order to take frequency data on a behavior? Interesting measurement question. It's a little different, right? We know what we're talking about frequency data. Frequency data is what? It's useful for counting how many times something occurs. What do we need in order to take frequency data? Because how do we pick our data collection system. It depends on the goal and the behavior. And so if we want to take frequency, what do we have to have? A, the behavior has to happen more than once during a session. Well, that's not necessarily true. If our frequency is 1, that is still a measurement. Behavior just might not happen very often. So A is not required. B, each response has to happen at least 10 seconds apart. B is not true either. With frequency, it can be difficult to take frequency data if behavior happens too close together or very rapidly, but there is no amount of time like 10 seconds apart. C, there needs to be a clear beginning and end to the behavior. Yes, C is required. Why? Well, frequency is a very concrete number. The behavior happens once, we count it as one time. If there's no clear beginning and end to the behavior, let's say a tantrum, which oftentimes doesn't have a clear beginning and end, that can be very hard to count. Can you do it? Yes, but you still need to identify the beginning of the behavior and the end of the behavior in order to count that behavior. So, what is required to take frequency? You have to have a clear beginning and a clear end to that behavior. Thanks for watching. Check out btexamreview.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.